This is Moving Mad in Medicine, hosted by Monel.
Hi, I am Monel, a doctor trying to make sense of medicine without losing myself in the process. And this is Moving Mad in Medicine, a podcast about working in a system that demands excellence, but rarely offers softness. Here we talk about the pressure, the ambition, the doubt, the quiet anger, the chaos, the relationships, and the questions we are not trained to ask out loud. This podcast is honest and reflective. Sometimes it is funny, and other times it is uncomfortable. If you're in medicine and you've ever thought of leaving it or reshaping it, or maybe just surviving it, come with me and let's talk. This episode is where we talk about the times you have to pause and reflect in very split seconds in order to be professional. I'll give you examples from my experiences. So there was this time where there was a patient who came into the accident and emergency. She obviously had a stroke, and she's an elderly woman, and we had to do a CT scan in order to tell what kind of stroke she had, obviously, because she also came with signs of raised ICP. And having written out the investigations and whatnot, the patient's relative, I don't really know if it was her relative, but the younger lady who was there with this woman was the person I had to explain to. And I told her, I said, you have to take Mama to do a CT scan. We need all the other tests, but this CT scan is the most urgent, and it's going to determine how we manage her going forward. Now, mind you, this woman obviously had a stroke. She had facial deviation and whatnot. It was obvious. I mean, there's a reason why they brought her here in the first place. So, having told this lady this thing, I explained further. When you're taking Mama to the diagnostic center, make sure you get an ambulance. She has to be transported properly. The reason is because we want to know what is going on in Mama's brain. We want to see what kind of stroke she has, and that would help us decide the course of treatment going forward. I shall put the whole statement for her and whatnot. And I left that bedside and I went to attend to another bed because it was A&E. There were patients, there were admissions. And in like 5 minutes, I heard, doctor. And I looked over from the other end of the A&E, and it was this lady I just explained to that her mom or her auntie, I don't know, needs to do a CT scan. And she was on the phone. She was holding the phone close to her ears. And she was calling, come. I took a very deep breath. This one wants me to talk to somebody over the phone, but no problem. I took a breath and I went there. And she was like, my brother wants to ask you a question. And I asked her, what question does he want to ask me? Honestly, I really did not want to take the phone to speak. And then he said I should ask you if the test we want to do for Mama, the CT scan, that told them you should get an ambulance for. If the test we want to do for Mama, if it's blood or if it's urine. Jesus Christ. I took a very deep breath. Like, my SpO2 was like 120 something. I took a very deep breath first before I responded. I was like, I just told you that we have to see what is in Mama's brain. So she has to do a scan. She has to go there so they can scan. They can do a brain scan for her. That is why I mentioned getting an ambulance and transporting her the proper way. She was like, oh, yes. That's what you said. And she was like, thank you. Bro, I'm like, is that why this person called me? I literally explained it. So sometimes your patience is being stretched out so thin, so thin that you just have to take a deep breath. At work, on a steady, my SpO2 is usually like 105 and above because I'm always taking deep breaths. Sometimes it can be a senior registrar or a senior colleague or somebody who just does something that is overboard and you're like, Lord Jesus. And you have to take a deep breath. Other times, it's you giving an instruction and the patient does something entirely opposite to what you just instructed, and you're like, oh my God. It's frustrating. And I realize that it's not something we always get to talk about. But yeah, almost every day, as long as you're in clinical practice, almost every day you have to take a deep breath. Even if you're just doing outpatient care, they will ask you questions that will have you take deep breaths. They will tell you things they do that are contrary to instructions and whatnot, and you just have to take a deep breath. So with time, I realized that this deep breath is actually necessary. When I say deep breath, I mean taking a pause before responding. It kind of helps you to stay grounded. It helps you to be professional with your responses, with your reactions, and yeah. I mean, you can't have enough of it. You just keep taking those deep breaths until I think it's until infinity, because you will always have reasons to to take such deep breaths. And another thing is that after taking those pauses before responding to patients, I may decide to just let it slide and act all calm. But I wonder where you now get to cross that line where you become numb and you no longer correct things. So let me give you an example. There's this patient as well. It's very similar. The patient had to do a CT scan as well, and for some reason, I just decided to check this patient's blood pressure before they moved the patient out of the ward. It was like afternoon time, so and it was 80/60. There's this patient as well. It's very similar. The patient had to do a CT scan as well, and for some reason, I just decided to check this patient's blood pressure before they moved the patient out of the ward. It was like afternoon time. So and it was 80/60. And I told the SR, and Snorri was like, they shouldn't move anywhere. They have to be stabilized and whatnot. And I'm like, okay. I went to tell the patient's relative, you cannot move your daddy because his blood pressure is so and so, and he has to be stabilized before he moves to go and do this scan. And I said this in the calmest way possible. Funny enough, a couple of hours before that time, this patient's relative was tearing up, poor boy. And I was like, you don't have to tear up. I mean, I didn't really say you don't have to tear up. I was just like, clean your eyes, don't worry, your daddy will be fine and whatnot. I just tried to be a nice doctor. I should have just minded my business. Anyway, so when I told them that they cannot move their dad, this same person whom I was empathizing with and they tried to like cheer up, he was like, you're not going to tell me what I'll do, my father. Blah, 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 blah. Obviously, I knew he was speaking from a place of fear. He was terrified and whatnot. As I just said, it was almost getting aggressive.
This is Moving Mad in Medicine, hosted by Monel.
If you've listened up to this point and you've not followed, subscribed, liked, or shared, please take a break to do that now and you can keep listening. Thank you. As I just said, it was almost getting aggressive. I just literally walked away. I went to inform the nurse. This is the blood pressure recorded. I've documented the patient should not move out until the blood pressure is in the hundreds, like until it gets back up. And I left there. Then the sister noticed that I left very quietly. She went to meet me and was like, she's sorry about how her brother is acting. That what exactly is the matter? I told her, it's what I said, your father's blood pressure is this, and he shouldn't move out now. When he's more stable, you can go and do the scan. And she was like, okay, fine. So I left work by 4 p.m. and I told the nurse, these patients should not leave until the blood pressure is up to this and that. He said everything I had to say. And then I left. So in the morning, before morning review, when I got to work, I went to see this patient. I wanted to check for the scan results if they were available. As soon as I got into the ward, the nurse told me that in fact, it was another nurse, different from the one I told the previous day. It was another person on another shift. And he was like, these patients did not agree to go and do their scan. Oh, their father's blood pressure has been up since yesterday. I was like, what happened? He said, this patient said, I said, that's the lady that came to meet me. She said that I said that they should not leave that ward until I return. Salobwa, me. You know that time when you take a very deep breath, like stand akimbo, and you're like, hey God, oh, these people want to put me in trouble. So it was really funny. It's funny in retrospect, but at that time, I was just frustrated. It's that murky water that you don't know if you are frustrated or irritated or angry. You're just overwhelmed. I took a deep breath and I went to meet the lady. I didn't even talk about what she had told the previous nurse or this present nurse. I just told her, please, you can go and take your dad to do the scan this morning. And she said, okay. And she just left. I didn't even have the energy to argue before I would tell her one thing and she would go and say another thing. I was just weak. I was just so weak. Anyway, what I'm trying to say is that there are those times where you just, after taking your deep breath, you just let it slide. And then there are times where you take a deep breath and you address the situation. So I wonder when I will get to that point where I get so numb that after my deep breaths, I just keep moving. Like that part where I am no longer emotionally invested. Yes, that's the word. Because I feel like the reason I get irritated or frustrated or tired, from being misunderstood is because I'm kind of invested. So for me to not really get that feeling, I have to detach. So even if I tell you don't eat eba and tomorrow I see you eating eba and fufu, I will not have to take a deep breath. I'll just be like, that's what they do. And then I move on. I feel like it may get to that point. I don't know how people hold it together. But at what point do you really draw the line? When do you really say, okay, I will just take a deep breath and move on? Or I'll take a deep breath, but I'll address this thing and correct this thing. Where do you draw the line? There are so many instances where you have to take deep breaths. So you have to make sure you make a conscious effort to be patient so that you can be professional. I am saying this thing because it is very difficult for me. Yes, it is. More often than not, I'm a very stand-on business person. I don't like rubbish. I can't tell you one and you do two, or I tell you one and you say I told you to. Bro, those people that want to put you in trouble. But yeah, it's quite difficult, and I wonder how long before I get used to it, or how long before I totally stop caring about it. Anyway, I will just say it's not really about staying calm or being patient. It's about being human. I'm not trying to advise anybody. I don't think I'm in the best position to give us any piece of advice, but yeah, I think it's just a way of staying human, and I do hope I never lose it. But in the meantime, I'll keep taking my deep breaths. And that brings us to the end of this episode. Thank you for staying to this time. Please follow on Spotify, Apple Music, subscribe on YouTube, and interact with all social media platforms. Feel free to send a message at movingmadinmedicine@gmail.com and you get a response. Take care and keep being a good doctor, or you can just keep moving mad. Bye.